We are going to be talking about the treatment of syphilis and the one thing you should worry about while on treatment and how you can manage that one thing, as well as the prevention of syphilis. First of all, syphilis is caused by Treponema pallidum, and one thing is that it grows very slowly, as we shall see how this affects the management. It is spread from lesions of an infected person to another person through intimacy, and also it can also be vertically transmitted. Remembering that the stages of syphilis are primary syphilis, secondary syphilis, and tertiary syphilis. Primary syphilis usually presents with a painless chancre, which usually resolves spontaneously, and the secondary syphilis, which usually presents with maculopapular rash, condylomata lata, and maybe some constitutional symptoms such as low-grade fever, malaise, weight loss, headache, generalized lymphadenopathy. Whereas tertiary syphilis, we have the gumas, tabes, paralysis. You can also have iotitis. Then now let's go to the management, the treatment. Now basically for primary syphilis as well as secondary syphilis, benzathine penicillin is used. Okay, why? And basically benzathine penicillin is in a depot formation, and it releases penicillin very slowly, given the fact that Treponema pallidum, which causes syphilis, grows very slowly. So it requires bactericidal concentration of penicillin to be present for many weeks so as to treat this infection. For those who are allergic to penicillins, doxycycline can be used for several weeks. Then for neurosyphilis, usually we use high doses of aqueous penicillin. Why? In neurosyphilis, remember the Treponema pallidum are within the CNS. So we give benzathine penicillin. We don't give benzathine penicillin because benzathine penicillin does not penetrates poorly into the central nervous system. So aqueous penicillin does the magic for us as it penetrates through the CNS. One thing that you should worry about: more than half of the patients with secondary syphilis treated with penicillin may experience symptoms of fever, chills, myalgias, and influenza-like symptoms after getting the antibiotics, and this is known as the Jaris-Haxheimer reaction. This is due to the lysis of the treponemes and release of the endotoxin-like substances by the treponemes. So management, how do you manage? Basically, you just do symptomatic management depending on the symptoms that are presenting, and symptomatically you can also give some aspirin. Okay, so how do we prevent syphilis? It's very important to establish an early diagnosis of syphilis and proper treatment of the infected persons, because they can spread from one person to another. And let's use condoms when you're having sexual intercourse, not forgetting that there's no vaccine against syphilis. Please make sure you subscribe to our YouTube channel for more medical videos. See you next time.